Hello everyone and welcome back to our channel where we keep bringing you the latest in health and medical information. Why do older people get more cavities? Yes, you heard it right. As we age, we tend to lose our teeth. And you might be wondering, what's so interesting about that? Well, when it comes to losing teeth, it's not just about aging. You see, when your teeth start decaying, it becomes a much bigger problem than just an unpleasant smile. It affects your ability to eat, speak, and even increases the chances of dementia. And that's because chewing and speaking require strong, healthy teeth. And if your teeth are decayed or missing, it can cause stress and strain on other teeth, making them more likely to decay too. Plus, eating becomes a real challenge, and that leads to malnutrition, which is linked to dementia. The good news is that there are simple things you can do to help prevent tooth decay as you age. So if you're interested in learning more about how to keep your teeth healthy as you get older, then this video is for you. In this video, we'll explore why older people are more prone to getting tooth decay and what you can do to prevent it. So let's dive in. The first reason is aging. As we get older, many changes happen in our bodies, including our mouths. For example, as we age, our salivary glands produce less saliva, which can lead to dry mouth. Saliva helps wash away food particles and neutralize acids in the mouth. Without enough saliva, it becomes harder to fight off tooth decay. Aging also causes changes in the gums, making them more likely to recede. This exposes the roots of the teeth, which are softer than the enamel and more susceptible to decay. Not only that, but older people are also more likely to have medical conditions and take medications that can cause dry mouth as a side effect. For instance, many prescription drugs, including those for high blood pressure, depression, and pain, can reduce saliva production. If you're concerned about this, talk to your doctor or dentist. They may be able to suggest alternative medications or strategies, like drinking plenty of water and using sugarless gum to stimulate saliva production. The second reason is dry mouth. We already know that saliva plays an important role in protecting our teeth from decay. When we eat, tiny food particles can get stuck between our teeth. These particles are like little magnets for bacteria in our mouth. The bacteria feed on the particles and produce acids that attack the enamel of our teeth. If left untreated, these acids can cause the enamel to break down and lead to tooth decay. Saliva helps to wash away food particles before bacteria can take hold. It also neutralizes acids produced by bacteria, giving our teeth a chance to remineralize and strengthen. Unfortunately, some people don't produce enough saliva, leaving them more vulnerable to tooth decay. That's why it's important to find ways to stimulate saliva production. One way to do this is to drink water throughout the day. Water helps to rinse away food particles and keep your mouth moist. You can also try chewing sugarless gum after a meal. This can help increase saliva production and neutralize any acids that have started to form. The third reason is receding gum. As mentioned earlier, aging can cause our gums to recede, exposing the roots of our teeth. However, receding gums can also be caused by other factors such as gum disease. When gum disease is left untreated, it can cause the gums to pull away from the teeth, exposing the roots and leading to decay. Brushing too aggressively can also contribute to receding gums. Aggressive brushing can wear away the enamel and dentin, causing the gums to recede. To avoid this, use a soft bristled brush and gentle circular motions. Finally, certain medications can cause gums to become loose and recede. This is more common with anti-seizure medications and some types of cancer treatment. If you suspect that a medication is causing your gums to recede, talk to your doctor or dentist. The fourth reason is mobility challenge. As we age, some of us may face mobility challenges such as arthritis or difficulty bending over. This makes it harder to brush and floss properly, increasing the risk of tooth decay. For those who struggle with dexterity or hand-eye coordination, brushing and flossing can be difficult. Tooth decay often starts between the teeth, and it's hard to reach these areas effectively without good hand-eye coordination. Plus, if you're in pain or discomfort, it can make it even harder to care for your teeth properly. Fortunately, there are some things you can do to make oral care easier. First, consider using adaptive equipment such as a long-handled toothbrush or a water flosser. These tools can help you reach all areas of your mouth more easily. You can also ask a friend or family member for help or hire a caregiver to assist with oral care. Another option is to visit a dental clinic that offers special services for people with mobility challenges. Many clinics have staff members who are trained to work with patients who have difficulty moving around. With a little creativity and assistance, you can find ways to make oral care more accessible. The fifth reason is certain foods and sugary drinks. Sugary foods and drinks can contribute to tooth decay by providing the perfect environment for bacteria in the mouth to thrive. Here's how it works. When you consume sugary foods or drinks, bacteria in your mouth feed on the sugar and produce acids. These acids attack the enamel of your teeth, leading to breakdown and decay. Sugary foods that stick to your teeth, such as candy and dried fruit, are especially harmful because they provide a constant source of food for bacteria. Similarly, sugary drinks like soda and juice can be just as damaging, especially if they're consumed between meals. That's because the sugar in these drinks has a longer contact time with your teeth, giving bacteria more time to produce acids. To reduce the risk of tooth decay caused by sugary foods and drinks, it's important to limit consumption of these items. Instead, opt for healthier snacks like fruits, vegetables, and nuts, which are lower in sugar and provide essential nutrients. If you do consume sugary foods, be sure to brush your teeth afterwards to remove any excess sugar and bacteria. Also, consider using a straw to drink sugary liquids, as this can help minimize contact between the drink and your teeth. Now you know the reasons why old people get tooth decay. Let's discuss the solution. To prevent tooth decay, it's important to practice good oral hygiene habits. This includes brushing your teeth twice a day with fluoride toothpaste, flossing daily, and using a tongue scraper to remove bacteria from your tongue. Regular dental checkups and cleanings are also essential to remove plaque and tartar buildup, which can lead to tooth decay and gum disease. A balanced diet that limits sugary foods and drinks can also help reduce the risk of tooth decay. In addition to diet, maintaining good overall health is important because certain medical conditions and medications can increase the risk of tooth decay. So be sure to talk to your doctor about any concerns you may have. Finally, do not smoke or use tobacco products as they can increase the risk of tooth decay and gum disease. By following these tips, you can help keep your teeth and gums healthy as you age. Remember, it's never too late to improve your oral health. Start today and enjoy the benefits of a healthier smile. We hope you found this video helpful and informative. If you did, please don't forget to share it with your friends and family. We would appreciate it if you could leave a comment below with your thoughts or any questions you may have. Your feedback is very important to us and helps us create more great content for you. Thanks for watching, and we'll see you in the next video.